Hi, this is Dr. Jennie Byrne. Today I'm going to spend a few minutes and talk about 3 tips to help minimize anxiety and avoid panic. So the 3 tips, they're pretty simple, but they do take some time and effort. The one tip is to educate yourself. So often what I do with patients here at the practice is really spend a lot of time educating them about what panic attacks are. And a simple way of thinking of it is that a panic attack is your body misinterpreting cues to think that there is a danger in your environment when there really isn't any. So the way people feel when they have a panic attack is the way they would feel in a very dangerous situation. They feel their breathing get fast, they feel their heart rate go up, sometimes their stomach hurts, they feel their muscles get really tight. These are all part of the natural fear response of the body, but in a panic attack, it's getting activated in error. And there's no actual danger, but your body is interpreting it to think that there is a danger. So the first thing is to really try to educate yourself a little bit about panic and what it is, and try to think about when you have a panic attack, what's happening in your body, what are you feeling like, and how does this relate to what a panic attack actually is. So the first step is to educate yourself, and if you're looking for a good book, I have an example here. This is one some of my patients have liked, get in the picture, the Panic Attacks Workbook. The author is David Carbonell. You can see it down there. This is a good workbook with some education sections and some worksheets to use, and I have a lot of people who really like this one, so it's something to check out. So the first step is really the education piece. And for some people, just knowing what a panic attack is takes away a lot of the anxiety surrounding panic. What's the second step? So the second step is to be an observer. So what you're going to do in the second step, and again, the workbook I showed you a minute ago has some good tools for this, is to observe yourself. So if you feel like you're having a panic attack or you're going to have one, really try to take a moment to see what is going on in your body. What are you feeling? What are you thinking? What are you doing? And you might want to even chart out how you feel over time. So maybe the panic attack only lasts 10 minutes, but you still feel kind of anxious for a few hours afterwards. You might want to document the level of anxiety over time during the day. You might want to document from day to day what your anxiety levels are like. And you really want to become an observer. And what you'll find with panic is that some things seem to be triggered, but often it's kind of this coming out of the blue phenomenon, where the panic attack just seems to come out of nowhere. And then what people tend to do is they try to associate it with other events. Like, for example, if a panic attack happens when you're in the car, you start to think that the car is causing panic. And then unfortunately what happens next is you start to avoid getting in the car. And obviously that's a problem for most of us who have to drive. So what you want to avoid is making false associations. And that's something that our brain is kind of hardwired to do. So to get out of that trap, you really have to work actively to say, that just seemed to come out of the blue. And it may be that your body has some sensation in it that you're noticing, and it seems to come out of the blue, but maybe you ate something that disagreed with you and your stomach's a little upset, and you're sensitive to that, and that's what triggers the panic attack. So being a good observer and documenting is another step that really helps. And then the third step I think that makes a big difference is to try to bring down your baseline anxiety by doing activities and behaviors which enhance your parasympathetic nervous system. And that's the part of the nervous system that keeps things calm. It's the opposite of that fear response. So what are some things that help your parasympathetic nervous system? There's a lot of variance on things like breathing exercises, yoga, meditation, mindfulness, even things like Tai Chi or other kinds of repetitions of movements. But all of these things have one thing in common, which is they really work to slow down your breathing or to control your breathing and to kind of control your body. So these help to bring down your overall level of anxiety because they're really activating the parasympathetic nervous system. So the more you can get these kinds of activities into your life, your baseline anxiety is going to tend to be lower. I shouldn't leave out exercise. Exercise is also something you can do to really help, but sometimes that's a little tricky for some people. When their heart rate goes up, they get that anxious feeling and they actually feel a little more panicky. So that's why that one's a little bit tricky. But the other ones, the yoga, meditation, and so forth, those are things that are becoming more and more commonplace, and it's pretty easy to find places where you can learn how to do that. So again, just to kind of recap, 3 things that will help you with your anxiety and panic, and maybe treat them and avoid the need for any kind of other intervention, would be educating yourself, reading some good literature, not just what people write on blogs, on websites, but actually try to get to some good literature sources and read. Trying to be a good observer and document what's going on and learn more about your body and yourself. And then 3, do activities on a regular basis, which can help with your parasympathetic nervous system. So those are my 3 tips. Now, of course, if you've tried these and you're still struggling with anxiety and panic, you might want to get assessed by a psychologist or a psychiatrist to see if there's something else going on. Sometimes it's even worth getting a medical evaluation to make sure that you don't have a medical condition that's causing you to have anxiety and panic. So try some of these tips, and if you're still struggling, I definitely recommend you get some help. If you want to start with your primary care doctor, you can, or maybe talk to a psychologist or a psychiatrist, and they can help guide you further. So I hope this was helpful. Good luck and have a good day. Bye.